Today's death comes exactly 5 weeks after Kern County saw its first case. The department did not give any details about gender, age, or city, and it's been tight-lipped about all of the information it has released so far. 17's Karen Hua has a breakdown now of the questions we asked, what public health has answered, what they won't answer, and how that might change.
Residents of some other California counties, both larger and smaller than Kern, are getting more information about coronavirus in their counties than we do. Kern Public Health has repeatedly said it's following guidelines from HIPAA and the State Department of Public Health. But does that check out?
We take these guidelines seriously. I can't answer why other counties don't choose to follow that.
This is the information Kern Public Health has provided so far. The number of positive cases, the condition of those infected, whether hospitalized, at home, recovered, or dead, the status of tests, very general age ranges, and a breakdown by 5 broad geographical regions.
The geographical information isn't essential for us to know to protect ourselves at this time, quite frankly.
Here is what public health has not revealed, what many in our community have demanded to know. A breakdown by gender, race, city, and a confirmation of cases at public places, such as schools, grocery stores, nursing homes, and the like.
Once we start getting more cases, we're going to be able to look at elements like age, sex, and different elements that we could release about positive cases to our community.
Public Health says what it can and can't release is based on HIPAA laws and guidance from the California Department of Health.
What I can say is we take the guidance set by the state very seriously, and we intend to follow it.
But under HIPAA, there are only 18 identifiers the county can't give out. According to the list, gender, race, and employer are not prohibited.
We may be in a position to release more detailed geographic information as long as we follow some defined parameters that they are providing, hopefully by the end of next week.
Looking at the California Department of Public Health, the state has created a breakdown by gender and race. But Kern does not plan to do that quite yet.
They are noting that there is disproportionate numbers for our African American population at this time. That's the information that we're going to have to point you to.
We have many remaining questions, both about the virus and the release of information. We want to know, how does it invade someone's privacy if public health reveals how many cases there are in men versus women, or Hispanics versus Caucasians? Does the public deserve to know? In Bakersfield, Karen Hua, 17 News.